Hi everyone, welcome back to the Facebook live streaming with Dr. Anthony Fong. Dr. Anthony Fong is a founder of Scholar Care Corporation, and he is also the spine cord bracer for children and adults. Today's topic is a very interesting topic, which is brace or not to brace. So at least this one can help the parents will know what to do when they find out their children have scoliosis. And if you have questions, please do not hesitate to type in the comments, and Dr. Fong will be happy to reply personally one by one. And I would like to thank also to Ms. Amanda Bonife Kiamko, who is a founder of Scoliosis Philippines. At the moment, she is also supporting us by broadcasting this Facebook live streaming in the Philippines. And so let us now welcome Dr. Anthony Fong.
Hello everybody, how are you? First of all, before we start, on behalf of everybody in Scholar Care, in both in Indonesia, Philippines, and in our sister company in Singapore as well, we'd like to offer our prayers to everybody in Philippines who have been affected by all the recent events, both in the south and also in Manila. And hopefully we're all well and safe. And we thank all the emergency services, the armed forces for their sacrifice and for handling all of this attacks recently. So now we will talk about spine cord, and we talk about whether to brace or not to brace. So this topic will be more broad-based because it'll be more about not just about spine cord, but also all the different options out there. Because one of the things that we always have questions is this classic question, which is to brace or not to brace. I know it sounds like something from Shakespeare, Hamlet, to be or not to be. But this is actually a very important question because one of the issues is, when do you brace? How do you know what brace is suitable for you? And if you go to a doctor, how do you know what options are available? So generally, if you suspect that you might have scoliosis, the only people that you should consult would actually be the medical doctor, who will then do their assessment, evaluation, send you for perhaps x-rays or other tests which are necessary. And then from there, they will then diagnose you whether or not you have scoliosis or not. And then, so the general guideline is x-rays will be ordered. And the x-rays usually will include anywhere from the neck all the way down to the pelvis. It's extremely important that when you take an x-ray, that you're trying to include as much of the upper body as possible, because we have seen x-rays where it actually chops off the top section, and that is really important because there are triple curves. And as we can see, this just so Mr. Dennis joined in, as you know, and we see this quite a lot in the Philippine Orthopedic Center, that there's quite a lot of cases where the patient presents with triple curves. So most commonly, when you go for an x-ray, you'll be referred for usually the midsection area, not realizing that there might be 2 curves in the upper body. And you may even have 3 curves. So if you're only focusing on the upper body, you may be missing the potential of picking up a lower back curve. So extremely important when you go for an x-ray, not only must you cover the neck area, but also the pelvis. Because sometimes you may have one leg that is shorter than the other, and this can fundamentally affect your scoliosis. And just because you have one leg that is shorter than the other, it doesn't always mean that that leg length difference will be responsible for your scoliosis. In most cases it might, in other cases it might not. And studies actually show that if you do have one leg that is shorter than the other, sometimes the pelvic rotation may be responsible for up to 6 millimeters of leg length differences. So slapping a shoe leaf into your shoe may potentially increase rotation or tilt in the pelvis, which might create an undesired effect. Now, the other thing as well is that when it comes to scoliosis, the other options is that when you do get diagnosed with scoliosis, the way this is evaluated is that you go for an x-ray, it'll be measured. The practitioner will look for the x-ray and have it, hopefully when you have it taken, not only must it be long enough, it must also be wide enough, because you need to see the top of the pelvis. So especially if you're a child, because on the top of the pelvis, you will usually see two little gray lines on the outside, and that is what we call the rhizocyte. So for that rhizocyte will also give the practitioner a very good idea of what rate of growth you're at what stage of your puberty you're at. Because in some cases, if you're between, say, rhiza 2 and 3, that is when your body is growing at its optimum, and so if you have a curve that is actually quite moderate, then that places you in quite a high risk category of further progression. So when you take an x-ray, once again, do make sure that if you get an x-ray, it is taken nice and wide and also as long as possible. So you can see the leg length up to the neck area, so you don't accidentally miss out the bottom section, and also your shoulders, because if you're only cutting it right in the middle here, sometimes you might not be able to see the shoulder tilt, or sometimes you can see the rotation of the ribs, and also whether the ribs are approximating on one side and flaring up on the other side. So this is extremely important here. Now, when you have the x-rays taken, usually the doctors will look at the spine and they will try and determine how many curves you have. And then they will look at the first curve and they will say, where is the upper limit? So that is the bone on the very top that is the most tilted. So they will look at the bone that is the most tilted on the top, and then they will mark a line across the top of that. Then they will look at the bottom of the curve and they will look for the bone that is the most tilted and draw another line across it. Then from there, they can either join together where it converges and they take a measurement, or from here to here, they'll take 90 degrees, and they'll give you the measurement. Now that measurement is known as the Cobb's angle. So the Cobb's angle is a kind of an international system or measurement of determining how do you tell if this scoliosis is considered mild, moderate, or severe. So there has to be some sort of a guideline, or at least in this case here, there has to be a certain sort of a grade. So if you're between 0 to 10 degrees, you're classified as being normal. And if your spine shows a curve that is more than 10 degrees, you're technically speaking considered as having scoliosis. Now, so if your spine is between 0 to 30 degrees, that is usually quite a manageable range. So if you had scoliosis or you suspected you had scoliosis, and you went to a medical doctor and you had a rehab doctor, for instance, or orthopedic surgeon, and they assessed you, evaluated, sent you for an x-ray, and they found that you're within this range, usually they'll recommend that you either do some exercises or do some rehabilitation, or you undergo monitoring, which in this case may mean that you'll come back in 6 months' time, 12 months' time, or in some cases come back on a much later date, just to see whether or not your scoliosis will resolve itself, or whether or not this scoliosis will continue to deteriorate. So within this range, between 0 to 30, you're classified as being manageable. Now, so in some cases, people will take up chiropractic, physiotherapy, undergo different types of exercises. Some people will be advised to do some swimming, or they will go through different types of regimes such as body combat, or the most recent one, Zumba. Okay, but once again, there's so many different types of exercises you can do. Now, if you're between 30 degrees to 40 degrees, usually this is classified as a range that is most suitable for bracing. But that doesn't mean that if you're between 15 to 30, what happens there? Because you will get cases where patients will be between 0 to 30, they're manageable, and let's say they're about 15, 16 years old, and their curve is 25 degrees. So does that mean at 25 you don't brace it? Okay, and does it mean you must wait until you are 30 and then you start bracing? So this is actually where we look back at the history behind these guidelines. So why is it that between 30 to 40 degrees is classified as a bracing range? Because once you go past 40 degrees, that is usually a category where the patient is advised that surgery would be the best option. So this is where we go back again and we start looking at this and we realize, hang on, in different countries they have different guidelines. For example, in some countries, if you have more than 40 degrees, you're classified as suitable for surgery. In some countries, they won't operate until you're about 50, in some cases even up to 60 degrees before they intervene. So once again, this is something that you do have to look at the country, you look at the different forms of practice, the way they actually have all these different guidelines. So when we look at the history, so why is it that when someone is between 15 to 30 degrees, they're usually told that they can do exercises and they don't need bracing? So this goes back to the history behind what type of braces were used. So for many years, for over 50 years or so, they've been using rigid braces, even as far back as a few hundred years, all the way back to Hippocrates. And back then, you know, they used to hang people upside down, put them on stretch racks, and they would even have all this hard cast around the body, and they would use that to try and correct the scoliosis. Or even back in the Chinese medicine, when they used to use bamboo, and they used to use bamboo on the sides of the spine, and they would wrap it up with cloth or linen so that would act as a brace. So for many years, bracing is actually not new. It's been around for centuries. So when we go back to looking at the brace, for many years, the gold standard has always been to use rigid bracing if you have scoliosis. But what the doctors actually realize is that if you do have scoliosis and you wear the rigid braces, your muscles will become weaker. Because what happens is that with rigid braces, you usually wear this for at least 23 hours a day. So you can imagine, if you're wearing a hard brace and you're not moving for 23 hours, your muscles will become lazy. It's kind of like a bodybuilder who stops going to the gym, the muscles actually will start to shrink over time. And if you don't use the muscles, you will get disuse atrophy, and it gets lazier and lazier. So most of the rehabilitation doctors, specialists that we spoke to. So back in February, I did a presentation in Conrad Hospital. It was an absolute pleasure being invited to do a talk to all the Academy, Philippines Academy of Rehabilitation Medicine. And one of the most common comments or feedback that we heard was that a lot of the specialists were saying that if they use a brace on patients, they will notice that the hard brace, and we're referring to Boston brace, Milwaukee brace, even braces like Yamamoto or Clark's brace or any of these other braces, they would actually comment that the hard brace was able to keep the spine straight. But however, it does not stop the spine from progressing. So what they realized was that when they wore the hard brace, the patient was able to maintain the curve. But the moment they removed that brace, so a lot of them said that when they remove the brace for their review, their assessment, immediately they will notice that the spine will collapse back into its previous position. So it was not able to sustain or hold on to that curve. So what they realized was that if you use a hard brace for a curve that's below 30 degrees, there's a potential that you may weaken the spine and further leading it to collapsing, or in this case, deteriorating even further. So there were cases where they will wait until it will hit 30 degrees. And only when it hits 30 degrees, then the doctor says, look, we've tried. We've waited, we've used exercise, you've tried physio, you've tried all the other options. And at 30 degrees, really, you have to bite the nail on the head, and you really got to do it. So this is why that guideline was created, where when your curve was more than 30 degrees, then this was actually a very good indicator that you do need to wear a brace. And once you go past that, if you've been wearing the brace and your spine doesn't stabilize and it continues progressing, then usually it's quite obvious that your spine is not going to be able to maintain that structure. So that's when surgery is implemented, because that's the only option after that. So going back to that, so that was the history behind whether you brace or don't brace. So for those of you who has been emailing us, you always ask, why do we brace that? When do we brace that? How do we know that we have to brace? Well, it really goes back to what is the guideline, or what are the options. So in some parts of Philippines, they're actually still implementing the hard brace quite a fair bit. So this will be based on the guidelines. And that's not to say that hard brace is not good for you. It's just that in different places you have to make do with what you have. So that is making the best out of the options that you have. So before we introduce spine core to to Philippines, that was actually what they had. So Boston brace was the standard. The Milwaukee brace was the standard. As a matter of fact, some of the hospitals we went to, they make one of the best Milwaukee braces I've ever seen. And the way they made the Boston brace, that was absolutely, it was artistically, it was the best that I've actually seen people make. And I saw that when I was in Philippine Orthopedic Center. The technicians there were absolutely phenomenal. So they make the best. But however, now we have new technology. Medical science has progressed. So research have actually developed over the years. So there's been a lot of research into all the different types of material, the braces used, the different types of options for scoliosis. So as we mentioned in our last talk, back in 1992, the Canadian government actually granted a $12 million research grant to orthopedic surgeon by the name of Professor Rivard and Dr. Collard to find out if someone, like, how do you get scoliosis? What is the basis behind scoliosis? What causes it? And once you know how it causes it, what is the pathway, or what we call the pathophysiology behind the scoliosis? And then the other thing is, besides that, what are the different types of treatment available for scoliosis? So now, with that in mind, there were 65 different researchers involved in this project. So what they found was that scoliosis is a genetic issue. There is very strong evidence behind it. And this is actually going back as far as 1952. There were research papers which actually indicated that there is a genetic background behind it. And then in 1992, 95, then SpineCore was created. So what they found was that if you wear the brace, let's say they found that you have scoliosis and you're more than 10 degrees and you're classified as being a scoliotic patient. So when do you brace? So if you are to be observed, which is the traditional recommendation, between 0 to 30, you're not having any kind of intervention. You're being monitored, you're doing exercises, but you're still not having that spine either stabilized or strengthened, or in this case, corrected. So this is where the issue comes that no intervention, the spine is going to continue progressing. You may do exercises, and even with the exercises, it may be able to strengthen the muscles, but once your spine starts to progress at a growth spurt and you're shooting up very fast, no amount of exercise is going to be strong enough or sufficient enough to keep that spine nice and stable or straight. So if the curve is quite mild, then the exercises has been shown to be quite beneficial. But if your curve is progressing and it's hitting 20, 25, 30 degrees, you can go swimming every day. You can do all these different exercises. You'll be able to reach a certain point where your spine becomes stronger. But once again, you will not be able, in this case here, to you can say, outrun how fast the spine is actually growing. So now comes another issue. When do you start bracing? So the general guideline with hard braces, rigid braces, is when your spine hits more than 30 to 40 degrees. Because any more than that, then it's surgical. Less than that, the fear is that if you wear the brace and your spine is less than 30 degrees, then you may potentially weaken the spine. So if you end up using the brace before 30 degrees and your spine gets weaker, then you're going to end up with scoliosis that is just going to get worse and worse and worse. So when SpineCore looked at this research, when the Professor Rivard and Dr. Collard looked at this research, they realized that using a hard brace is probably not the best option. So this is actually how the soft brace was developed. And when we say soft brace, it's not just cloth. It is actually elasticized, so it actually provides quite a fair bit of resistance. So if any of you have ever seen the exhibition, so we'll be presenting in the scoliosis awareness event that will be held in late June, and you will probably see different exhibits of the SpineCore material, or you can actually go to one of the SpineCore providers and ask them to show you what the components look like. So the elastic bands used are actually quite tough, they're resilient. So as much as they're quite flexible, they have quite a fair bit of give in it, but there's a lot of resistance in it. So the research behind it was that scoliosis was not just an issue of muscles. So you don't have scoliosis because your muscles are weaker or one side of your body is actually stronger. So it's kind of like saying that the reason why you have scoliosis is because your spine, the muscles are pulling on both sides, and it's like a tug of war. So that's not really the case. So what they found was that when you have scoliosis, it is an issue of how the nervous system works. It is an issue of how the bones are growing. And it also has to do with muscle, the tone, the symmetry behind it. So when you address scoliosis, you don't just treat only the bone. You don't just try and rehabilitate a person to try and get the nerves working more in a synergistic way. Or in this case here, doing lots and lots of exercise to build up the muscles. You can't just do one component without addressing the other. So in order to treat scoliosis, there's a few things that has to be addressed. Number one being is whatever the apparatus that you're using, whatever the device, the brace that you're using, it has to target all three at the same time. So it has to be able to address the muscles, the bone, and the nerve all at the same time while activating the muscles so they become stronger, so the muscles are constantly contracting, relaxing. Then it also has to deal with the nerves, or how your nerves are working. If you look at your joints, the joints in your body, every single joint in your body has what we call proprioceptive nerve receptors. So these are little nerves or receptors on your joints. So every time you walk, these joints will rub against each other, and they rub against each other at a certain angle. You get maximum stimulation. That will actually send information back to the spine, all the way back up into the brain, down the spine, and out into the body. So that's actually what we call biofeedback mechanism. So if I was tilting to one side, my joints will have more compression on that side. So that will actually tell my body that, hey, look, there's a lot of impact on that area. I might need to increase electrical stimulus to make sure the muscles on the other side are strong enough to prevent me from falling over. So the muscles on the other side will contract. So that will try and provide some sort of a foothold, so that a foundation so I can stand without dropping over. So for that to happen, your brain will send, your spine will send messages up the brain, then it will coordinate with your ear and your eyes. So your eyes, your ears will then send message to the brain as well and say, hang on, you're tilting. Okay, your ears are telling your brain that your head is tilted or it's rotated. Your eyes are telling you that the horizon is also tilted. So this will then tell your brain that you're not standing straight. So that will send signals up and down the spine and affect all the different muscles on the side of the spine to try and counteract that so that you can maintain balance. Now, so if you were going to wear a hard brace where you are fixated at a certain point and there's no movement, it has the ability, so if your spine is tilted at an angle and it's been pulled open, yes, the hard brace has the ability to open up a joint that has been compressed. But studies have shown that opening up a joint does not stimulate bone growth. So in the past, they used to believe, and this is actually based on Wolff's law or Hutter-Volkmann's law principle, that if your spine is tilted, the more you tilt, the more pressure you put on the side that the spine is bending into. So in this case here, if this is my spine and I'm tilting over to this side, there'll be more pressure on that side. So they have found, and studies have shown, that the more pressure you put on a bone as it's growing, it actually inhibits that bone from growing. As a matter of fact, it can even slow it down or even stop it completely. So the idea behind it was, so that's how you get scoliosis. So the compression actually causes the scoliosis, and it actually stops the bone from growing. So what they thought, and this was the idea and the principle, the theory back then, the hypothesis, was that if the compression actually stopped the bone from growing, then the most natural thing is to remove the compression, open it up. So the idea was, if you open up the joint, then that bone should grow. And that was actually how the principle of the rigid brace actually came along. And they realized that, okay, in order to do this, we have to look at the movement of the spine. So they realized that the joints moved in 3 different planes. So we always talk about the 6 different planes, but naturally there's 3 different combined movements. So you're either hunching or you're over exaggerated straight, you may be tilting to one side, there's rotation. So in order to follow this theory that to resolve a scoliosis, you have to take pressure off a bone, you have to remove the pressure off that bone. So this is where the hard brace follows the principle of what we call the 3-point pressure. So now, if I'm hunching, the brace will be designed to try and straighten me out. If I'm tilting to the left, the brace will be designed to try and pull me and open up the left joint so I'm bending more to the right. And if I'm rotated to the left, the brace will be designed to try and unrotate me. So this is actually the basis and the mechanism behind a hard brace, a rigid brace. And so for many years, this was classified and considered the gold standard of how you treat scoliosis. And in recent studies, they found, and this was actually going back in 2007. In 2007, the Journal of Pediatric Orthopedics, they found that in this case here, one being is that rigid braces, if compared to, say, the Providence brace or the spine cord brace, and this was actually using the SRS criteria. So following this criteria, they found that number one being, rigid braces were only 15% effective in stopping the scoliosis. And they found that 21% of the patients who used the hard brace were able to avoid surgery. However, that also meant that 79% of patients progressed to surgery. So they found that not only was the hard brace not effective in stopping the surgery, it was not effective in many cases, like 15% effective in stabilizing the spine. So this was actually quite a revelation because this was the gold standard. So then they looked at all the other braces like the Providence brace and they looked at the spine cord brace. Now, going back to this bracing, it is not to say that going to surgery is a bad thing. Because when we talk to a lot of patients, and we talk to a lot of people, we get a lot of emails, a lot of messages, and one of the things is that everybody's saying, I want to avoid surgery, I don't want surgery, I don't want a surgery. And we absolutely appreciate where you're coming from, and we really understand why you're trying to avoid it. Because surgery is not a walk in the park. It is actually a complicated, and it's actually quite a major procedure. So one thing is that when we look at your spine, there are cases where it is actually the best option for the patient. So there will be many cases where we do see patients present to our office with their parents, and they're absolutely mortified and they do not want to have any kind of surgery. And they've been delaying the surgery as much as possible. Now, as much as we understand that you're trying to look for other options, but by delaying that surgery, you are actually delaying the necessary treatment for the patient. We do see cases where a patient is having a severe tilt. And you can imagine your spine controls, your nerves goes down the spine. And from there, all the nerves from your spine comes out and it controls absolutely every single organ, muscle, every single tissue in your body. So if there was any kind of irritation to that nerve, whether it's compression or irritation to that nerve, it will also affect the nerve function. So in this case here, we do see patients where they'll present with a mild tilt and yet they're having breathing problems, heart problems, or they may have quite a large curve in the lower back and they're losing bowel and bladder control. So under these circumstances, you cannot avoid the surgery because that will actually place you as a medical emergency. Okay, and we've actually seen cases where we have patients present, twins as a matter of fact, and one of them actually passed away because the surgery, because the scoliosis was so severe that he started having breathing problems and actually died from that. So going back to this, in many cases when you talk to a lot of the orthopedic surgeons, and a lot of the orthopedic surgeons are actually quite sympathetic and understanding about this. So a lot of people actually fear orthopedic surgeons thinking that you go there, they'll definitely want to do surgery. As a matter of fact, a lot of the orthopedic surgeons that we have encountered, they usually will try and recommend other options first. And a lot of them actually will say, look, why don't you try this. And when you've tried all of that and you've exhausted all the different options and you realize that, look, I've really tried to avoid the surgery, I've been doing the exercises religiously, I've been wearing the brace diligently, I've been extremely disciplined in my exercises and my lifestyle change, the way I stand, my posture, but the scoliosis is getting worse. Then under the circumstances, then the surgery, at least then, the surgeon can say, look, at least we've tried. So now the surgery is justified. So that is actually one of the options. So now we're going back to the brace again. So when do we wear the brace? So when they use the spine brace, they realize a couple of things. One, because it's elasticized, it allows stimulation of the muscles to strengthen, and it allows open and stretching. So it allows contraction, relaxation of muscles. It's like going to the gym and doing weightlifting with resistance bands. So your muscles will constantly be activated at least tens and thousands of times in a day. Then, because it also changes the way you stand, the way you move. So in children, the number one objective is what we call corrective movement, which is to alter the way that your posture is standing. And in this case here, that is also to stimulate the nerve supply up and down the spine. So that changes the feedback system. Now, going back to the bone, now we mentioned previously that the principle of Hütter-Volkmann's principle, you can always email us, we can always give you the spelling for that. I know it sounds pretty complicated. Okay, we're not here to try and mystify you. But when it comes to this principle, it was understood that the compression inhibited the bone from growing. So to open it will allow the bone to grow. So the hard brace was able to open the joint, but it does not stimulate growth. And studies actually show that this is what we call static distraction. So if you open up a joint, that bone doesn't grow. So in order for that bone to grow, and this is assuming the patient that you're dealing with is still going through puberty, going through growth spurt. Now, once you're an adult, your spine has already solidified, what we call ossified, and it's not going to grow anymore. But if you're a child, you're still growing. So in this case here, the opening and closing of the joint and opening and closing of the spine, and that will actually alternate the pressure on your bone. So the impacting of the bone, the stretching of that joint, the impact, stretching, and this is repeated over tens and thousands of times a day. This has been shown to stimulate the bone to grow. So once again, it depends on what age that you start. If you're young and you started doing this alternation of opening, close, then what that does is that the opening and closing effect. Okay, so with the opening and closing, sorry, that was Ginny playing with the computer. Okay, with the opening and closing of the spine, what it does is that it alternates the pressure and stretching, and that actually stimulates the bone to actually grow. So that is actually something that the spine cord brace and the dynamic brace has been able to demonstrate that. Because when you wear the brace, although it is actually providing quite a fair bit of resistance, it is actually providing the supportive, the structure, and also stabilizing the spine. It does not limit or restrict your movement. It allows you to play sports. As a matter of fact, some of the patients that we brace are hip-hop competitive dancers, cheerleaders, we have ballerinas, we have gymnasts, we have patients from all walks of life. And they will actually testify that when they wear the brace, yes, initially it may feel a little bit stiff, but it doesn't limit their activities. They're able to do basically any kind of sports except for swimming. You can't wear it for swimming. You can try, but it's not waterproof. So when it comes to the brace, it allows movement. So it also allows education of the body. So if I was hunching and I was tilted and I'm using the brace, not only does it actually educate how my muscles should be behaving, it also activates my nerve supply. So it actually activates nerve messages back and forth from my brain to my spine to my body, but it also allows the alternation of the pressure that stimulates the bone growth. Now that is actually for children. Now we go to adults. And we've actually had rehab doctors asking us, look, this brace is obviously designed for children, because when you look at the procedure and the protocol for spine cord, a lot of it is actually catered to, correction of the spine or correction of the scoliosis, or just trying to slow it down from getting worse, or stabilization, or providing structural support. Spine core actually has many different purposes. For the pediatric brace, it really depends on what stage of puberty or growth you're at. If you're a child and you have not embarked on your growth spur yet, you have the ability in some cases to actually reduce the curve. Now that is actually to say that the number one objective of the spine core brace is actually not to try and reduce the spine or reduce the curve, or in some cases to actually reduce the angle. So when we approach patients with scoliosis and we recommend the spine core brace, you have to be absolutely, in this case here, you have to be absolutely truthful in terms of what it can do and what the limitations are. So the number one objective when it comes to spine core bracing is that we're trying to either, number one, slow it down from getting worse. Number two, to actually maintain some form of stability, okay, to strengthen the spine, okay, to build the muscle structure up, to improve the posture. And that is actually mostly for children. And in many cases, we do see reduction of the curve. But once again, that really depends on how large the curve is. Then we look at adults. When it comes to adults, the spine core brace is not designed to reduce the curve. Now, I know that a lot of you have been looking at our website, you've been looking at all the different x-rays that's been presented, and you do see quite a lot of good examples there. For example, Amanda is one good example, but we also have quite a lot of other patients as well who are adults. And as a matter of fact, we actually have quite a lot of x-rays on our website, so do email us. We'll also give you another website that has more x-rays in there. So it's actually, we have hundreds of x-rays actually. So you can actually see a very good large sample number. So these are not x-rays of just 5 or 6 people. You can see x-rays up to 70, 80, even up to 100 people in there. So they're not just children, they're also adults. So you will see quite a lot of cases where even in adults, the curve actually reduces. But once again, when we use spine core, the objective for adults is actually pain management. So that is the number one objective. It is actually not for reduction of scoliosis. But in many cases, when we do brace, and if the curve actually reduces in an adult, that is absolutely fantastic. Okay, we always tell the patient that is a bonus, but that was not our objective. Okay, so when we get patients coming in who are adults and they say, I want a curve exactly like that. Okay, I want my spine to improve like Amanda or in other cases of other patients. We always tell patients, look, you've got to be realistic. When we are bracing, as for adults, not only are we trying to use this for pain, but there has to be evidence of progression. So if you're an adult and we look at your old x-rays and we look at your new x-rays, and it does show that there is progression, then that also justifies the bracing. And the last one is actually not only pain, progression, but your posture, your structure. So some patients will want the brace for cosmetic purposes, what we call cosmesis. So they want to improve their posture, they want to improve the way they stand, the way they walk. Then if we can justify it, then yes. So for adults, the size of the curve is not a limiting factor. However, once again, you've got to be realistic. If you have an adult with a curve like 90 degrees, 100 degrees, they're absolutely not suitable for bracing. But we do get cases where the patient maybe say 60 degrees and they're adults. But however, for us to brace them, we usually will recommend that the patient go and see a spine doctor or rehabilitation doctor, at least a medical doctor, so we can coordinate or co-manage this case. Because sometimes when you have a curve that large, it's already causing quite a fair bit of instability in the spine. So for those cases, we have to make sure that there is always a medical doctor or a specialist on standby. So in the event that despite your best options, the spine does get worse, there's always something to fall back on. Okay, but for other cases such as 50 degrees or less, it is actually quite suitable for spine core. Now we also have another question about what if the patient is 15 degrees? So if let's say they're between 15 to 30 degrees. Now we previously mentioned that from 15 to 30 degrees, normally the patients are told that they don't need a brace. And this is actually, once again, based on the hard brace. So when we talk about spine core, that is different. Because with spine core, if your spine is between 15 to 30 degrees, you can actually wear the brace to manage the scoliosis. And the reason being is that the reason why it was not recommended for many years when it was because they were referring to the hard brace. So it was in reference to the hard brace that you cannot use a hard brace for curves between 15 to 30 degrees because the lack of movement will cause muscle wastage or weakening of the spinal structure. But with spine core, because of the way it was designed with the elasticized band, with the resistance and the way that it re-educates the body, it is actually quite suitable that you can wear it. For Donna, you mentioned, is it advisable for a 21-year-old patient who suffers from lumbar dextroscoliosis? The answer is for adults, yes. Even for lumbar curves, absolutely. But once again, it really depends on what is the size of the curve. And in terms of the cost, the pricing of spine core in Philippines is actually fixed by UK. So Spine Core UK is quite adamant that they do not want the pricing to be over expensive or competition, let's say, with other countries. So you don't want the case where you might look across the shore and say, hey, look, Korea is actually having spine core. They must be cheaper there. Or look, Malaysia has it, or Singapore has it. So the pricing is set at a certain point where whether you have it done in Philippines or you have the spine core done in another country, the price is literally almost the same. And also the traveling cost, because you do need to have follow-up visits, so it doesn't make it practical. So we actually had a case where a lady actually did mention that she flew all the way to, let's say, America to have a brace done because she thought that it would be probably, say, cheaper or better or something. And yes, the providers in America are absolutely fantastic. But the cost of flying to America, accommodation, flying back, that does not make it very practical. So that was actually one of the reasons why Scolio Care was established, so that we can provide this brace and the services to Philippines so that the patients do not have to travel so far. And we are slowly trying to introduce spine core into all the different parts of Philippines. At the moment, we have it in the south in Davao. We also have it in Manila. But very soon, we'll try and push it to Visayas, so into Cebu and Iloilo, so any of the other neighboring islands, so that way, patients don't have to fly all the way to the south or to the north. So we'll try it. Hopefully, we can try and get spine core into as many places in the Philippines as possible. And once again, in terms of the pricing, the price of the component is fixed. The only difference is actually the price of the bracing fee. So each practitioner will have a different bracing fee. So this is something that you can look at our website, scoliocarecorporation.com, and it has a list of all the practitioners in Philippines who are available to do spine core bracing. So you can contact them and you can discuss it with them, like how much they charge, what is the fee, what is the fee structure. You'll find that the spine core providers are really very approachable. Okay, so because when it came to spine core training, we're quite strict and discerning when it comes to selecting practitioners, so that we can maintain not only the philosophy, the image of what we do, so that way, when you do see a provider, you notice that the personalities are almost quite the same. Okay, so hopefully that answers your question. But once again, if you have any questions, by all means, please don't hesitate to email us or call us, and we can discuss in more details. Okay, Vanessa, you have a daughter that's 42 degrees. She's now 15 years old. Is she still advisable to wear the spine core brace? As advised by her doctor, if her scoliosis reaches 45, she may be operated on. Okay, when it comes to your, Vanessa, when it comes to your daughter who is 42 degrees, she's now 15 years old. So that really depends on what stage of growth she's at. So we do get quite a lot of patients who are, let's say, 12 years old, and they're already in the middle of their growth spurt. And at 15 years old, the spine is already beginning to mature. It's slowing down. So in your case, the recommendation is she advisable? Well, she's actually in a very good a spine core range at that point at 42 degrees. But once again, we do need to see what the curve looks like, and we also need to see what the x-rays look like. Because we need to, when you see a spine core provider, you will notice that they will remark the x-rays. Because there are certain procedures when it comes to marking x-rays, it has to be absolutely accurate when it comes to the angle. Because the difference between getting, say, 38, 35 degrees and 45 degrees can be a matter of just using the wrong landmarks. So you may be off just by 1 millimeter, and that can mean as much as even a 5 degree, 10 degree difference in the measurement. So once again, when it comes to this, you need to do an absolute full assessment. And I agree with Mr. Dennis. Mr. Dennis Astipona is from Philippine Orthopedic Center. So you can always pop in to see him. He's actually one of our most experienced providers. So you can always see him, get a full assessment, and see whether or not you're suitable. And Mr. Dennis is certified for both pediatric and adult. As a matter of fact, he's certified for using all the different types of spine core components. So spine core has actually have 3 different types of brace, and he's actually quite capable in using all of them. So going back to your question, Ms. Vanessa, so for your daughter who's 42 degrees, 15 years old, absolutely. So do see one of the providers. Let them do the full evaluation assessment. Do bring your x-rays, and not just your most recent, but all the x-rays, whatever you have. Because it's extremely important to look at your new x-ray, your old x-ray, and the most recent one as well. Because that can actually give you a very good timeline, like a chronology of how the spine is progressing. So in some cases, you may see an x-ray that's 5 years old, and you may have seen that the curve was only about, say, 15, 16 degrees. And then another x-ray may have been taken, say, 2 years later, and it's still about 18 degrees or so. And then your most recent x-ray, which may be only 1 year later, shows that it's now 50 degrees. So that actually tells you that the spine has just gone from 18 degrees and now it's 50 degrees within 1 year. So that will give you a very good indication that this is actually quite an aggressive scoliosis. So that will also give the provider a very good idea of how to manage it, what type of components to use. You know, some of the components in spine core are actually quite strong. Okay, the elastic bands are actually quite resistant. Okay, so this is extremely important. Whatever test you have, do bring it in. Let your providers go through that. Hello, Ms. Ong, you have a 36-degree scoliosis in your lumbar area. You recently developed it in your thoracic area as well. Your orthopedic surgeon said that you're a suitable candidate for surgery, but that was 2 years ago. Is there any other methods to reduce the degree? You're 19 years old. Can spine core lessen it? Once again, at 36 degrees, you are within a good management range for spine core. Usually, spine core is quite suitable between 15 to 50 degrees. If your curve is more than 50 degrees, let's say you're hitting about 55, 60 degrees, the only time spine core will allow you to brace a curve of that magnitude is every single provider has to send all the evaluation to the spine core trainers. So the spine core trainers will then look through all of the evaluations, all the assessments, look at the x-rays, the clinical findings, radiological findings, they look at orthopedic tests and everything. And it is within the protocol, and as long as it's within the protocol of bracing, then they will usually say, yes, you can try this, or we can use this method, use that technique. And then, if the curve is actually quite large, in some cases the orthopedic surgeon may say, look, you're not ready for surgery yet, but they may actually recommend, why don't you try something else like a brace? So within your curve, you're 19 years old, your curve is 36 degrees. You also mentioned that it is developing in the thoracic area. Now that is something that you are within the treatment, the protocol for spine core. So once again, it'd be a good idea to get an evaluation to see which is the primary source. Because sometimes you may have a lower back curve and you've been treating it for quite some time, not aware that it's actually in the upper body. And sometimes the upper body is actually the primary source and the lower back is actually a compensation. But in your case, it's possible that the lower back is actually the primary, upper body becomes compensation. So in order to tell whether or not this is your circumstance, I would recommend go and see a spine cord provider and have your spine evaluated to see what options are available in there. Okay? And Mr. Dennis, once again, yes, that is correct. It is within our protocol. Yeah. So going back to 15 degrees, we do, when you look at an x-ray, because of the way the x-rays are taken, they're usually taken at approximately 175 to 200 centimeters, so within 2-meter range. So the further you are from the x-ray tube, it does create a little bit of magnification. So this is why when you take an x-ray, there's usually a 5-degree plus or minus give and take. So if you're looking at someone who is 15 degrees, that can either be 10 degrees, could be 20 degrees. So this is one of the reasons why when we look at an x-ray, we see someone with a 15-degree curve. You don't necessarily jump in and start bracing them. For someone who is 15 degrees, when we brace them, usually there are quite a number of things that has to be able to justify this. One being is there any history of scoliosis? Secondly, are there any family members with scoliosis? Or another one is, has there been evidence of progression approximately 1 degree per month for the last 6 months? So if you notice that a patient presents with a curve that's 15 degrees, they have all those other criteria, their curve is progressing for the last 6 months, they have a family history behind that, and they're quite young, then yes, you can justify bracing at 15 degrees. And usually you do see quite very good reduction in that. But once again, that really depends on the age, the type of scoliosis it is, and whether or not there's any wedging of the spine. Because sometimes you may see a spine that is not a hemivertebra. So hemivertebra is where you're born with a spine that might be almost like a triangle shape. But sometimes you see curves where the curve has been there for quite a certain number of years, and over time that actually causes bone remodeling. So the bone actually gets narrow or shorter on one side, larger, and it continues growing on the other side. So that can actually, in some cases, with spine cord, if it's been detected early and it's been braced before they hit that growth spur, there are x-ray evidence that you can actually see where the spine actually does grow back. And we actually do have a few of that as well. Ms. Fong, going back to how much will it cost and where can you do this? Do you have backache when you stand for or sit for prolonged periods? Or is your bag heavy? When it comes to heavy bags, generally the guideline is that your bag should be approximately 10% to 15% of your body weight. So in some cases, if you're using the bag, and some people either you're carrying it on your side, if let's say you're not using that bag and you still get back pain, then it is important to get looked at, because one being, it could be what we call facet imbrication, where your joints actually are rubbing against each other, or you're getting muscle contraction. But how much would it cost? In Philippines, the maximum recommended retail price is 99,000 pesos. So that is the maximum recommended retail price. So spine cord does not recommend the price to be sold more than 99,000. So in this case here, some of the practitioners, and that 99,000 includes the cost of the components, the bracing fee, and in some cases the evaluation, the post-bracing, etc. But once again, that really comes down to the practitioner. Some of the practitioners that we spoke to, they might not charge you that much. So they might charge less for their assessment fee. But in many cases, the guideline is maximum retail price is 99,000. Okay? Yeah. But once again, do talk to the providers. Some of them actually do have different prices varying as well. Yeah. But the component price is absolutely fixed. Yeah. Mr. Dennis, Ms. Fong, yes. So you may contact Mr. Dennis for initial assessment. Absolutely fantastic. So go and see him. Yeah. Okay. Okay. Wonderful. So I hope that answers the question. So do you brace or don't brace? So once again, it really comes down to what is the objective of bracing. We do get patients coming in who are, for example, adults, and they say, look, I have a nasty curve and I want you to bring it down to 0. And the answer is no, that is not going to happen. Okay, but do we get cases where we see the spine go back down to zero? And the answer is yes, we do. And can we guarantee that you will have a curve that is going to go down to zero? The answer is no. But do we see it? Yes, we do. Okay, but that is not what we call usual. Okay, and in the case of children, that is actually more likely depending on the curve. Because we do have children who come in with a curve like 24 degrees, and we just had one recently. And within the first bracing, went from 24 to 7 degrees within that same day. And we also have other cases where the patient was a right curve. After bracing, we managed to get it all the way down, not only past zero, but to the left, so that we allowed overcorrection, so you can open up the joints, stretch it, stimulate the muscles. So in some cases, it really depends on the objective of the bracing, what type of curve you have. Is there rotation? Is there any tilting? Is there any shift? So in some cases, if you're an adult and you have pain, then when we're dealing with adults, one of the first things we always do is that our number one objective is to try and reduce the pain first. But once we're able to reduce the pain, then it's also to try and stabilize the spine, strengthen it up as well. Okay? Yeah. Once again, thank you very much. Has been, once again, an absolute pleasure. Do stay safe. Okay? I'm currently in Indonesia, and I'm hearing a lot of news about what's going on in Philippines. And once again, our prayers go out to all of you. And please do stay safe and absolute best, for the armed forces, the emergency services, for everything that they're doing as well. We also hear a lot of very good stories of the locals actually providing shelter and food for the locals as well. So that's wonderful. Just before I go, I just have one last question we had from Jam. You're asking that what degree is required to wear the brace? Well, the brace is actually, the protocol for spinal cord brace, once again, is between 15 degrees to 50 degrees, so 15 to 50. If the curve is more than 50, so more than 50 degrees, then that has to be co-managed with either a spine specialist or rehabilitation doctor. So, because for those kind of curves, it is, once again, you need to be very, very cautious and careful with how you manage that type of curve. For example, if I have a child that presented with a curve that's 50 degrees and the child is 9 years old, I would absolutely will not brace this patient. Okay, so just because your spine is within 15 to 50 degree range, your age is also extremely important. So if I'm, say, 5 years old and my curve is 30 degrees, I'll be very, very worried about this patient, because that is actually considered quite a severe curve. But if I'm, say, 40 years old and my curve is 30 degrees, then I would not be so worried about the chances of progression. Whereas a child that is, say, 10 years old and has a 25 degree curve, that has a high likelihood of progressing. As a matter of fact, in 1984, there was a paper published by Lonstein and Carlson. In 1984, in the Journal of Bone and Joint Surgery, this is going from the top of my head, and I'm quite correct with this. The Journal of Bone and Joint Surgery, 1984, Lonstein and Carlson. The research actually showed that if you are 10 years old or younger, so if you're 10 years old or less than that, and your curve is between 0 to 19 degrees, it is a 43% or so chance of progression. But if your curve is 20 degrees to 29 degrees, it is a 100% progression. The predictability is that it's 100% progression rate. So once again, when you look at a child, it really depends on what is the angle, the presenting angle. If you're looking at an adult, that is very different. For adults, you need to look at what we call balance, sagittal balance, coronal balance, which means if I'm looking at a patient from the side view, are they leaning more forward, leaning more backwards? If they're leaning more forward by, say, 12 millimeters or 16 millimeters, that actually can cause a lot of instability and, in some cases, pain. If I'm looking at a person from the back and I notice they're leaning more to the left or more to the right, but more than 12 or 16 millimeters, that's once again what they call coronal instability, and that has been associated with pain as well. Now, if I'm looking at an adult, and the adult actually has quite a large curve, the degree, the magnitude of the curve actually does not predict progression. And this is going back to another paper which was published in 2010 in the Journal of Bone and Joint Surgery. Once again, Journal of Bone and Joint Surgery. It was actually the British publications. So in that paper in 2010, the author was Fong et al. So they realized that if you have rotational subluxation, so if the spine actually shows quite a severe amount of rotation or there's indication of rotation in the spine, then that is usually a very good predictor that scoliosis is going to be progressive. So once again, when it comes to assessment of scoliosis, the angle is only just one of the parameters that we use to see whether or not you're suitable for bracing. So there are actually quite a lot of things that you've got to look at. You've got to look at the balance, the degree of the balance, how much shift there is, how is that spine sitting, is there stability in there, are there any evidence of what we call spondylolisthesis, or sometimes the spine might slide more to one side. So that's what we call olisthesis or lateralisthesis. So a lot of these type of conditions need to be taken into account to see whether or not you're suitable for the brace. So we have cases where a patient may be, say, 15 degree and they have pain and they want to be braced, and we said no, because it doesn't justify it. So once again, it really comes down to you need to have a full assessment, have your spine evaluated, have an x-ray done, or if you have x-rays, bring them in, let the provider decide whether or not that x-ray is sufficient enough or you need new ones. Because sometimes we have patients who present with x-rays that were taken on the same day, but the view was missing the upper portion or half of the hips were missing. So unfortunately, if the image is actually not correct, that can also affect the way you've been managed as well. Because if you miss that third curve, or in some cases you miss the fact that you've got one leg shorter than the other, that can significantly alter the way you get managed as well. Okay? Once again, thank you very much for joining us. It's been an absolute pleasure. I'll be in Philippines soon, actually. I'll be going back there twice this month. And I will leave it back with Ginny. Ginny has some announcements to make. So just to finish up, once again, stay safe and looking forward to seeing all of you. If you do bump into me in any of the events and anything, please drop in and say hello. I would absolutely love to see who you are, okay, to see the face behind the name. Okay, thank you very much. Absolute pleasure. Yeah, I think from what Mr. Dennis taught me last time, Walang Anuman. Yeah, thank you.
Thank you very much for everyone's watching live Dr. Anthony Fong, and also I would like to thank Dr. Fong for the very interesting topic today. Hopefully he'll be having more and more interesting topic in the future. So please invite more people to like Scholar Care Corporation Facebook, and also we would like to invite you to mark your calendar. Dr. Anthony Fong will be soon in the Philippines, and on this coming Saturday at 12 noon, he'll be a guest in a TV show or TV program they call the What's Up Doc, and it's hosted by Dr. John Seneca, and it will be aired by GNN Network, and you can watch if you have Sky Cable. You can tune to the channel 213, or if in Destiny channel 1, and in GSAT channel number 1. So thank you so much. Also, I would like to thank Mr. Dennis. Hi, Mr. Dennis, who joined this live Facebook streaming. He is one of our providers. So if you want to know more about other providers, or including Mr. Dennis' contact address, you can visit also our Scholar Care website, which is www.scholarcarecorporation.com. So thank you so much. See you until next time.
And just one more last comment, just before I go. I'd like to thank all our staff as well for this week. The spinal cord trainer from UK is currently in Philippines, and all the providers are currently being groomed, okay, through the training. So it's actually quite a tough training. So I have to sincerely thank Amy, Irene, Jeannie just came back from Philippines, and also Dave, for everybody for being there. And in this case here, as a matter of fact, today they started at 7:30 in the morning, and they left the hotel at almost 5 o'clock in the morning. Avoid the traffic. So thank you to Amy, Irene, all of you, And Ginny, she just came back from the south actually, where all these events were happening, all the attacks were happening. And once again, thank you to all of you, and for all the providers in Indonesia, where we say "Semangat," go for it. I know the tests are actually quite grueling, but it's for the better good for everybody in Philippines. Okay, everybody in Philippines is actually relying on you. Okay, I know there's a lot of pressure for me to say that, but they're relying on you to do your best, learn as much as you can. Okay, because when the trainers are there, so we have the trainer from UK there at the moment, Mr. Matthew. So when he's not there, I'll be there as well, also doing the assisting the training, and Amanda as well for broadcasting. So we'll be there constantly updating, teaching more new techniques to the providers. So all the providers are constantly being updated with new techniques, new procedures. So have absolute faith in your providers. Go and see them. And Mr. Dennis also just mentioned that Matthew is exhausted. I'm not surprised. They started at 7:30 in the morning. So all of you, go for it. Godspeed. Thank you.
Okay, thank you. See you next time.